So, before we'll talk from the meeting. Okay. Thank you all so much for being here this morning. My name is James Talarico. I have the honor of representing House District 52 here in the Texas House. Honored to be here with Chairman Ford Price. We were hoping for Senator Kolkhorst, but she is laying out a bill in committee right now, which tends to be the case this time of session. I want to tell you a story that I haven't shared publicly before. In May 2018, I was a healthy 28-year-old running for the Texas House, and I decided to walk the entire length of my district and hold town halls along the way. I hike Big Bend every year, so I wasn't worried about my ability to do a 25-mile walk. But halfway through, I started to feel fatigued and nauseous. And right before the town hall in Hutto, Texas, I vomited in the bathroom. I figured I was severely dehydrated, so I changed my shirt, drank some water, and continued with the town hall and with the rest of the walk. I threw up 4 more times over the last 12 miles, but somehow I finished. After the walk, I went to bed thinking all I needed was a good night's sleep, but I slept for 36 hours. My parents got concerned and rushed me to the emergency room where nurses checked my blood sugar. Normal blood glucose level is below 100, and mine was 900. I was immediately diagnosed with type 1 diabetes. Unlike type 2 diabetes, type 1 is an autoimmune disease. While the cause is unknown, genetics are believed to play a role. All I know is my pancreas abruptly stopped working one day. I was in diabetic ketoacidosis, DKA, which is a life-threatening condition that ends in coma and death without insulin. After 5 days in the emergency room, I fully recovered. Now I have a constant glucose monitor on my arm, and I take shots of insulin every day. If I take care of myself, then I should live a long and healthy life. In 2019, I walked those 25 miles across my district again, but this time with insulin. Even with health insurance, I paid $684 for my first 30-day supply of insulin, the medicine that I need to live. I had to put it on a credit card. Now that I'm a legislator, I have excellent state health insurance, and so I can now afford my insulin. Every Texan should be entitled to the same. In the last 20 years, the price of insulin has skyrocketed 1,200%, while manufacturing costs have remained relatively constant. It costs companies less than $10 per vial to produce insulin. And there are 3 primary reasons for this increase. One, it's a monopoly. 3 companies control the $27 billion global insulin market, and so they can control and fix their prices. 2, there is no generic. Insulin is a biological product, not a chemical product, which makes it harder to produce a generic, which is called a biosimilar. The big 3 companies enter into play to delay schemes where they pay potential biosimilar manufacturers not to enter the market. Lastly, there's no competition. The big 3 companies surround their initial patents with lots of other patents so that the original patent lasts longer. This is a process known as evergreening. Then they spend millions in campaign contributions and lobbying to prevent policymakers from closing any of these loopholes. Putting profits over people has deadly consequences. Texans with diabetes use GoFundMe pages or turn to the black market to get their insulin. And in the richest country in the world, 1 in 4 diabetics will risk their lives to ration their insulin. Like fellow Texan Alan Rivas, the same week in 2018 I was diagnosed, 20-year-old Alan was rationing his insulin because he couldn't afford it. And on May 11th, 2018, Alan's mom came home and found him dead 2 days before Mother's Day. My legislation, House Bill 40, which I am honored to joint author with Representative Price, would cap out-of-pocket costs for insulin at $50 a month and require HHSC and the Attorney General to investigate rising insulin prices. This is a bipartisan, bicameral effort. Our bill, House Bill 40, joint authored by Representative Price, Representative Lucio, and Representative Sophronia Thompson, is signed by 103 members of the Texas House, a supermajority in the chamber. The Senate bill, SB 827, is authored by Chair Lois Kolkhorst and signed by 17 senators. If our legislation passes, Texas would become the 16th state to cap the price of insulin in the last 3 years. It would also become the largest state to do so. No person with diabetes should die because they can't afford their insulin. With this bill, we can help ensure that. Now I'd like to turn it over to my friend and my colleague, Chairman Forprice.
Well, good morning, and thank you all for being here. It's really, it's quite astounding, the statistics that Representative Talarico just stated. It's something because I'm not sure how many folks are actually aware of this. It was after the last legislative session that I met with a handful of parents and constituents from the district that I'm privileged to represent, and I was alarmed. I couldn't believe the stories they told me with regard to the cost of insulin for mainly their children. These were concerned parents that I met with, and they had type 1 children that, you know, that's hard enough to manage and deal with the scary possibilities that, you know, present themselves with a child that has diabetes. But it's also scary, the variance between what it was costing those parents to pay for the life-saving insulin that they had to have month in and month out for their children. So I listened to them and I asked them, and it was a room about this size with about 40 parents, and I asked them all, what do you all pay per month for insulin? Of course, it varied because some folks were uninsured, some folks had good health insurance, some folks had insurance that was better than others with regard to what they had to pay. However, it varied from less than $100 a month to more than $600 a month, just in that small group of parents. So it was at that point in time, and after following up and meeting with them and doing our own due diligence in our office and talking with other stakeholders and advocates and doing research about what other states have addressed this issue and why, and looking across the spectrum of issues that present themselves with regard to this matter, I filed House Bill 1701. Now, I'm a joint author of this bill with Representative Talarico and his bill, and support Representative Lucio's bill and Senator Colcourt's bill. I mean, I'm really grateful to be part of a team of members, both bicameral, Senate and House, bipartisan, Republican and Democrat, to move this issue forward. Every single day we wake up and think about how can we better move that legislation, because we don't have much time left in this session. We would like to see this bill pass, and as Representative Talarico said, we'd like to be the 16th state to address that matter for not only our constituents, but for millions of Texans who are afflicted with diabetes and still need this life-saving drug. It's a positive step to make insulin more affordable. It definitely will do that, and it will have a life-changing effect on millions of Texans. So again, I'm really grateful for not only those families and those constituents who brought the issue to my attention originally, but I'm grateful to all our colleagues, both in the House and in the Senate, who are recognizing that and moving this ball forward, because I'm very optimistic that this bill will pass and that we will positively affect the lives of millions of Texans. So thank you for being here.
Good morning. My name is Reva Verma. I have been a volunteer with the American Diabetes Association for many years. I am a small business owner in Houston, and I have type 1 diabetes. Thank you, Representative Talarico, for introducing this legislation. I support HB 40 for these reasons. I was diagnosed with type 1 diabetes when I was 11 years old. That is 18 years of nonstop 24/7 grind of dealing with diabetes, no breaks. Many others who also live with type 1 diabetes, those of us who are insulin dependent, never get to pretend like we don't have diabetes, not even for a few hours. Because if we do not inject ourselves with insulin, our blood sugar rises and causes all sorts of problems, long-term and short-term. We get headaches and foggy memory to irritability, loss of vision. We could lose our limbs, organs, and much worse. The cost of insulin has risen significantly over the last few years. I am a small business owner that owns and operates a full-service digital marketing company. We are a young company, and our employees are generally healthy. In order to keep our health insurance costs in check, we contracted for high-deductible insurance plans for our employees, including myself. For the first few years, the plans worked out as the cost of insulin was manageable. However, over the past couple of years, insulin costs have soared. For the last 2 years, I was paying about $1,200 for 3 vials of Novolog, a 1-month supply of insulin for myself, until my $3,500 deductible was satisfied. Prior to this, it used to take me 10 months to meet the deductible, but all of a sudden, I was having to find the money over a 3-month period instead of 10. In order to spread the cost out over the year and not have a brutal cash drain over the first few months of the year, we were forced to upgrade to a lower deductible plan for all of our employees. While this plan helps to lower the cost on my day-to-day pharmacy trips, it overall increases and negatively impacts my bottom line. So while the cost is hidden in our day-to-day lives, it just keeps draining my resources. The cost of having diabetes are numerous and don't just include insulin. For example, I am fortunate enough to be on a CGM, which is a continuous glucose monitor. However, the cost runs me an extra $3,000 a year. No one should ever be put in a life or death situation due to the rising cost of insulin, where they are constantly worried, should I put food on the table or should I buy my medication? We need to do better. HB 40 helps us thrive and not just survive. Thank you.
Well, we'd be happy to answer any questions if there are any. And again, we thank you all for being here and helping to cover this important legislation both in the House and the Senate. We'd be happy to answer any questions if there are any.
Any concern about this not passing? I mean, I know there's a lot of priorities this session, and of course this is one of them, but with so many other issues, is there a concern at all that maybe this doesn't rise to the top in other lawmakers' minds?
Well, I'd be curious what Chairman Price thinks, because this is only my second session, so I'm still full of naivete about what's possible in this building. And given the amount of support that we've received both inside and outside the Capitol, I'm optimistic that we can get it done. And we're in good shape when it comes to the calendar. Our timeline looks pretty good. We have 2 more months left to get this done. The Senate bill has already been voted out of that chamber and is waiting to be referred in the House. And then today is when we're hearing House Bill 40 in the Insurance Committee in just a matter of hours. And so that's pretty good. But again, there are always unforeseen events in a legislative session, and so we don't want to get ahead of ourselves. But Chairman, do you have a take on it?
I, like Representative Talarico, very optimistic with the chances of success for the bill or a bill to pass. And I really think that whether it's a Senate version or a House version, one of the nice things about this environment on an issue like this is even though there were multiple efforts separately in the beginning to start to see some progress made on this very specific issue, I don't know anybody who has pride of authorship, who wants their name on a certain bill, or it has to be a House bill, or it has to be a Senate bill. There is tremendous effort to see this succeed in both chambers and through both parties. And I'm really grateful to Representative Talarico for not only being courageous enough to share his personal story, something very private, but also taking such a leadership role in making sure that this is an issue of high priority and of momentum, and I'm really just proud to be part of a legislative effort to see this be successful. Now, I do believe that we do have time. It's hard to pass any bill, as everybody in here knows, no matter what, and under the best conditions. But with as much support in both chambers and with as much attention and circumstances like this to really shine a light on the problem and get out and take a position that I think everybody can benefit from, publicly, will help. And so I'm like Representative Talarico, very, very optimistic.
In terms of the insurance company aspect of this, I mean, you need to be careful about towing that line, right? I mean, people rely on the insurance for so much of the healthcare space. And so what is your message to insurance companies about making sure that they are working with the patients and working with Texans to care for them in the best way?
Well, I'll start and then I'll turn it over to Representative Talarico. I think, in Texas, there are lots of patient assistance programs that private health plans and manufacturers will offer patients today. But it's not affordable for everybody or appropriate for everybody. There are circumstances where, you know, it may be available 1 month or 1 quarter of the year, but not the following quarter. It's very unpredictable and inconsistent. I think there's a desire by a lot of manufacturers, or the three, I hope, to work with health plans and with the legislature to bring that into line with something that is more manageable, more affordable for all the Texans that are affected, all the millions of families that have to deal with this. Because as we've heard and as the statistics bear out, the cost has skyrocketed over the last decade. And so it's appropriate to deal with it responsibly, and I think there is a deliberate effort to do that with all stakeholders. Not everybody's going to agree all the time, but it also affects the uninsured. Texas has a high percentage of uninsureds, you know, in our state, and so, you know, this would make, if this bill passes, would make the cost of insulin more affordable for those who are also uninsured.
You know, the only thing I'll add is that by being potentially the 16th state, we've had a chance to see how this has worked in other areas of the country, rural states, urban states, red states, blue states. And you know, there have been threats in every other instance where this has been introduced that it would increase premiums and kick people off their insurance, and none of that has happened in any of the other states. We should also point out that other countries pay a lot less for their insulin than the United States does. And so there is clearly a problem here with our healthcare system and our insurance companies that I think it's the government's responsibility to help fix. And if Senator Colcourse was here, I know she would say, you know, insulin is one of the few medications that people depend on to live. You know, this legislature has made progress on EpiPens, but insulin, I think, is the next item on the docket, because people will die unless they get the medication they need. And as you've heard from both of us who have diabetes here, this is not something that we choose. It's not something that's a result of our own actions. I was 28 years old, perfectly healthy, and got this illness, and I rely on this to live every day. And no diabetic in this state should go without their insulin just because they can't afford it.
How many people would this impact? You mentioned it would cover both uninsured and people with insurance. Who exactly is covered by this?
So this bill would only cover people with insurance, but I should mention that Dr. Oliverson, the chair of the House Insurance Committee, is authoring House Bill 18, which I know Chairman Price and I are supportive of, which would create a fund so that Texans with diabetes could get their insulin at a discounted price. So because this has become such a problem throughout the state, throughout the country, multiple legislators are working the problem from different angles. And so I'm hoping that we can make progress for people with insurance, which you've heard, even with insurance, the cost can be prohibitive, and for the Texans that don't have insurance as well.
And you also mentioned that drug companies have been raising the price of insulin all the time. Why not cap what they're charging instead of capping what consumers pay? Why not go through the whole supply chain instead of just doing this one section?
You know, there have been folks, especially in states that have already passed this, that have said we need additional measures to help bring down the cost and help make insulin affordable. This is a complex problem. There are the manufacturers, there are the insurance companies, there are the pharmacies. Every point in the supply chain needs to be addressed if we're going to deal with this holistically. And I should mention that, you know, although we have seen, you know, folks with insurance not be able to afford their medications, the problem is much worse for those without insurance. And so I think that's why HB 18 is even more important this session than it has been in previous legislative sessions. Any other questions? Well, again, I am so thankful that you're all here, and I'll be hanging around afterwards if you do need any clarification, and our offices are also available if there's more information that you need. And our HB 40 is being heard in the Insurance Committee today in room, what is the room? Does anybody remember? It's on the one-pager that you have. So if you want to come to the Insurance Committee, you're more welcome to that too. Thank you all again so much for being here.
Thank you all.
No, thank you, sir. I appreciate you being here. I know you're busy, so.
That's great. No, it's
And I know the senator wanted to be here too. She's laying up two bills at the same time. So anyway, I'll let you know how the insurance committee.